Hello, and welcome to the series that's designed to help people with long-term illness, including long COVID, and those who are living with a disability, and also their carers. In this video, I want to get onto the gnarly subject of dealing with professionals. There are many people who think that the professionals know everything and that they take their word as gospel. I think that's unwise. I think the most powerful way of dealing with professionals is to see it as a partnership. It's your body. There is a video about becoming an expert on you. And I think that ultimately, when you hand over the responsibility for your health and well-being totally to the professionals, you're doing yourself and them a disservice. Now, I'm not decrying doctors, please don't think that, or any professional for that matter. They've spent years and years honing their craft and learning how best to help people. But they're not God, they don't know, and they can be wrong. Also, many doctors have a particular way of being. I've had doctors like Professor Finlay, who have been incredibly helpful and supportive over the years. I've also worked with doctors who've had the professional bedside manner of a wardrobe. Knowing yourself, questioning, always politely and always with some level of authority, in the sense that it is your body. If you read Vicky's book, Taking Responsibility for Your Own Health, you'll find really powerful examples how, by questioning what the doctors said, the oncologist said, she extended her life, and she expanded the quality of her life very, very significantly. And that may be true for you. But if you just think that you're going to go to a professional, they're going to give you a pill and you're going to get better, then I think you're doing yourself and them a huge disservice. You have to take part in this. You have to take responsibility for your part in either getting better, or if that's not a possibility, perhaps you've had, your spinal cord has been severed. We know that you can't make that better. However, you can make your quality of life very significantly better. And part of that is how you interact and how you work with the professionals who are part of your care. So, how can you do that effectively? Well, the first and foremost, I think, is recognizing that it is your body and becoming an expert in that. If you have questions, write them down. I've been to support many people when they've gone to see their specialists or other professionals like OTs and so on. And one of the things that struck me is how often, because patients are so desperate to get their story out there, that they ramble on, and the professional involved has got to try and find the meat in all of the huge ramblings that are part of what is being given to them. That takes time, and these days they're given very little time to talk to patients. And so order your thoughts before you go. Write down what you want to ask and what you want to say. And sometimes you read that because you find that you want to say it exactly as you prepared it, and pre-frame that with the doctor by saying, this is really important to me and I've spent a lot of time putting this together so it's clear. So I'd really appreciate it if you would hear me out before you start to respond to it. By doing that, you then feel a sense of control within the situation, and they have the opportunity to be able to identify what's important to you. If you find the doctor's so busy writing a prescription or writing on the computer, and that's one of my particular pet hates, I appreciate that they're busy and that time is short, but at the same time, I want them to see me. And so recognizing how you do it is really important. Neutral voice, but a voice that's not, oh, please, not a victim voice, not a whiny voice, but a voice that says, look, this is really important to me. I'd appreciate it if you'd make eye contact and if we could have a proper conversation. In my experience, when you do it in that way, 99 times out of 100, the reaction is a really positive one. And with the one that isn't going to react in that way, nothing you say or do is going to make them react positively. And it's time to think about whether that's the right professional for you to work with. Keep notes. You know, all of your records, your test results, your scan results, who you've seen and what's been said, either you or your carer, I would really urge you to get those written down. Because in my experience, all too often, they're trying to navigate their way through your notes. Mine look like War and Peace. If you think about it, they've spanned, you know, the time since 1983. I'm the one who can say, look, my blood test results in October were, the scan was read and this is what happened. You can help them utilize the time that you have at your disposal in a much more productive way if you're prepared. And it's really difficult to trawl back. It's easier to keep those notes as you go. Create a folder, and a folder that is organized. Don't just dump them. Now, I'm not suggesting that you have to do it the minute you get back from the doctors or the hospital, but before you forget, put them in some sort of order, because then when you need to look back through them, you will find it easier to do. Another area, I think, is where you're told you need a scan and you should hear within 2, 3, 4, 5, 6 weeks, and you don't hear. Many of the people I have worked with have got lost in the system, and the system is creaking. Now, there is a balance between chasing something and being a blessed nuisance. And so I would urge you, if you're told it's going to take 4 weeks, wait 4 weeks, but then start to chase. Don't start chasing on day 2. But do follow it up, because things do get lost. You know, I know for myself that I was going to have a procedure and I was told it would be about 6 weeks. When I phoned on 6 weeks and 1 day, they said, oh, we've got no record of that. I could go back to the consultants and say, did you write? And it turned out that it got lost, God knows where. Take responsibility, but do it in a way that is constructive and positive. And if you are finding it very difficult because you find concentration hard or communicating hard, then engage somebody else to help you. I've been with many people on their appointments to be their advocate, to take notes. If you know that it's hard to remember what's said, and all of us find it hard to remember when, you know, we've waited perhaps 6 months to see the consultant, there's a lot said and we come out and then we've got to try and remember. I would urge you to take somebody with you. Even though I'm well practiced in this, if it's at one of the important visits, then I've often taken somebody with me. But I've been really clear about the role I want them to play within that appointment. Please come and be a note taker. Or I'm feeling very vulnerable at the moment, I need you to fight my corner, or both, or neither. You be the arbiter of what you need. When you do work well with your professionals, it can make a huge difference, and you can have that dialogue about their opinion and their advice and how you feel about that. And you're then better placed to be able to say to them, look, that's had this impact on me, or I'm fearful of taking drugs. And I've got a terrible track record that drugs that don't affect anybody that they've seen before with any side effects, I have really bad side effects. And I've come to the conclusion, and Professor Finley used to talk about my exquisite sensitivity to things. I thought that was a rather nice way of putting the fact that every time I was given something, my body fell apart. But I recognize that in that dialogue, you can find a useful way forward. I hope that's been useful. You'll find that in the book that Vicky and I have written together, you know, Taking Responsibility for Your Health, and the details of that are in the description box, that at the back of the book, we've created a whole range of prompts for you where you can set your questions and so on. And getting used to organize it can be difficult, so you may find that really helpful. And in the back of the book about how to live with long-term illness and disability, I've created a space for you to notice how you are, so you can start to recognize your patterns. And knowing those patterns can be really helpful for the professional when you visit them. So, hope it's been useful. There's lots of other videos to help. You take care, and I'll see you in the next video. Bye-bye now.